In the interest of honesty and transparency in government, I'm creating a three-part series on fraud and waste. I'll address the CCAP fraud and the FTE waste in separate videos, but in this first one, I want to talk about the billion-dollar-a-year Medicaid fraud. This year, Governor Walz and the Democrat Socialists in St. Paul are attempting to raise taxes and increase spending. This means that they're asking you for more of your hard-earned money. And they're doing this without first addressing the rampant fraud in government programs, much of which has already been identified. Medicaid, or MA as it's known in Minnesota, is a health insurance program for families or individuals with low or no income. And it's paid for by all taxpayers and administered through the Department of Human Services. And DHS is responsible for administering this program at the state level, but they also supervise the implementation of the program by all of our 87 individual counties. To receive MA, you must be below a certain income level, you have to be a citizen of the U.S. or a legal immigrant, and lawfully reside in Minnesota. And, of course, you have to be alive. If someone applies for MA, the income is largely self-reported by the applicant. Now, there's over 1 million people receiving medical assistance here in Minnesota, and it costs taxpayers $10.8 billion a year. Now, you used to be required to meet with a social worker at the county to apply for MA, but now we actually pay private navigators a fee for every person they sign up. And these navigators are also able to pay people to fill out applications to receive MA. In 2015, a large amount of fraud was suspected, and DHS was required by law to perform periodic data matching between recipients and the federal database, which lists income reported by the legal employers. In other words, government has access to verify income of applicants, but they weren't doing this. DHS said that they could not systematically compare these two databases unless they were given $1.6 million to do so. Well, the legislature complied, and after 4 years, we finally have some results. A simple comparison of MA beneficiaries' actual income reported to the federal database shows that more than 10% of recipients are not qualified to receive this benefit. They make too much money and they fail to report this income. 1% of fraud equals $100 million. So over 10% fraud means there's over $1 billion per year in fraud. Since 2015, Minnesota taxpayers have been defrauded of over $4 billion. Meanwhile, government continues to grow by an automatic 4% every year. This is like begging for money without first cleaning the money out from the couch cushions. In this case, billions of dollars are in the couch cushions. Now, we need to perform periodic data matching to confirm eligibility and also to enable counties to verify eligibility upon initial application. We should also be performing clawbacks from the insurance company and navigators who were paid to administer this program. We need to protect these important social safety nets for Minnesotans who need them most. Now, if you care about education or transportation or other state government spending, you should really encourage your legislator to not spend a dime more until we clean up this rampant fraud in government programs.